Thank you for joining us on this Sunday morning. I'm Hugh Keaton in for David Elliott, and we start with the pandemic, the growing coronavirus cases around the state and around the country. But vaccines are arriving in our community and the battle against COVID-19. Singing River Health System pulmonologist Dr. Ijlal Babar joins us now. Doctor, thank you for joining us. And it was a record-setting week, not only here in Mississippi, but across the country. We saw case averages in Mississippi rise to more than 2,000 per day, hospitalizations at an all-time high. What is driving all of this case transmission right now?
I think it's, Hugh, I think it's the post-Thanksgiving spike that we were expecting to see. That's what we're seeing right now.
Is it frustrating, or how frustrating is it that we are this far into dealing with this and we've seen waves, but this is the biggest spike that we've seen?
It is very frustrating. It's frustrating having to deal with patients just dying. I mean, we try our best, but there's only so much we can do. And, you know, for us being on the front line, it's hard to deal with this. It takes its toll.
Statewide in Mississippi, we're seeing more than 1,000 COVID hospitalizations, more than 300 in the ICU at Singing River, your health system. How many COVID patients are you dealing with this week?
Right now, we've got about 51 between the three campuses. In one ICU, we've got 8 patients. The other ICU, we've got 6 patients. And we've also got patients on the floor who are just severely ill.
Is that the highest numbers you've seen, or is it only a slight uptick from what you've seen in the past?
It's not a huge uptick. It's a slight uptick from what we've seen. But I think what's happening is the number of people who are just coming through the ER is higher than it's been. And, you know, we're having to house and manage these patients in the emergency room in greater numbers than we've done before.
So you would say you're seeing more symptoms, COVID-like symptoms?
Yes, yes.
All right, but there is good news on the horizon. Singing River started receiving shipments of the vaccine this week. Your medical staff started receiving it. I understand that you received a dose of the vaccine. What was the experience like for you?
Not bad at all. You know, I had a little ache in the arm the next morning. Ibuprofen took care of it. I actually went to the gym and worked out the day I got the vaccine. Now, it is a fact that the older you are, and I'm 54, the less the severity of symptoms. But by and large, these symptoms are not going to be severe.
I see. And what's the next steps here? I know you're going to continue vaccinating your staff long before it actually reaches the general public. Yes,
yes. Right now, that's our main objective, is to vaccinate the staff. I anticipate that over the next few months, we're going to get enough vaccine to pass on to the public, but certainly not at this point.
Not, and you say a couple of months away, realistically, right?
Yeah, I think so, yeah.
Now, I understand you are taking part in some experiments coming to coronavirus. You're watching your COVID patients very closely. And tell me about this research that you're doing and what you're hoping to learn from it.
So, Hugh, right in the beginning, we gathered our experience with patients that we took care of for the first 3 to 4 months, and we have sent that for publication. It is going to be a view of managing patients in the community hospital setting, which is missing right now in the literature. The second project we are working on now is to see how patients on the ventilator do. Again, there's not very much information out there on that. And the community hospital perspective is important because that's where 75% of patients in the nation get their care. We're at this time also participating in a national trial that's coming out of Beth Israel on COVID patients. So we are one of 30 centers in the nation to be part of that trial right now.
Why is it so important to learn as much as we can? People forget this virus is only a year old, less than a year old, really. And how challenging has it been to keep up with the trends and learn as much as you can as we go along?
I think, Hugh, this is an unprecedented situation. Very few people actually lived through a pandemic like we're doing it right now, all of us. And we have the opportunity and actually the responsibility to learn as we're going along. And that's what we're doing. Why are we doing the research? Why are we doing everything? We're trying to base everything on evidence that we do, because that's the best way to practice medicine. So instead of randomly prescribing medications or randomly doing a certain practice, we're actually gathering data so that we can look back at it and learn from our mistakes as well as the things that we do right, and hopefully share it with the public also.
Now, you have firsthand experience with COVID patients in the ICU, quite frankly, the ones that are worse off. What is your experience and what are you seeing from those patients? How difficult of a situation is it for them?
It's a very difficult situation. It's not just having COVID, it's also the isolation. The fact that these unfortunate patients have to be in a room, they're cut off from their loved ones. These rooms have negative pressure, so they have this constant buzzing, humming going on. And this wears on the patient's nerves. I mean, it wears on our nerves when we go in for a little while to examine them or to give them the medication. So it's a very difficult time for these patients. And then, of course, some of them get to the point where they end up on a ventilator, and that's not good.
For the patients who have recovered, are you seeing any long-term significant impacts on down the road after you would classify them as fully recovered?
I have only a few patients in my clinic that I'm following after they've recovered. Some of them, I do have to say, have persisting changes on their x-rays, and they are still having difficulty with their breathing. I wouldn't say all of them, I would say some of them. So I don't think the verdict is out yet on what is going to happen to these patients. I think we need to have studies to longitudinally follow these patients so that we can decide.
And one last question here quickly. How are the treatments doing right now, and how improved are the treatments over the last couple of months?
The treatments have kind of remained static as far as inpatient treatment is concerned. We have the dexamethasone or the steroid, we have the remdesivir, and then the convalescent plasma we're not as sure of at this point in time. The big development is on the outpatient side, where you have these synthetic antibodies that we are using quite a bit, and I think that's a big addition to our armamentarium. And then, of course, the vaccines.
All right, Doctor, thank you for joining us here this week and certainly putting into perspective the scope of this virus here at our local level. Have a good Christmas week.
You too. Thank you.